with law enforcement and the community project initiated by the Moscow Human Rights Commission and the Latah County Human Rights Task Force. The overall goal of this project is to provide information and foster discussion and community engagement on the role of law enforcement in our lives, and to learn about how the city and county see their missions and evaluate their activities in protecting and serving our community. In these divisive times, it is vital to be proactive and work together to ensure safety and avoid misunderstandings and confrontation. Thank you for being a part of this important discussion. Next slide, please. So what is a crisis intervention team? It's an innovative first responder program, and there's specialized training that goes along with it for law enforcement regarding individuals who are experiencing a mental health crisis. And it protects those that are in crisis by safely de-escalating the situation and figuring out what comes next. Next slide, please. So why should I care about crisis intervention teams? Well, 1 in 5 of us, or 20% of individuals in the United States, is living with some form of mental health illness or mental health disease. The Crisis Intervention Team program ensures that all first responders are trained in appropriate responses. Next slide, please. That's me, I'm Kathy LaFortune, and I'm your Latah County Commissioner for District 1. Next slide, please. I would like to now introduce our panelists for this evening. And in keeping with our holiday season, our first 3 panelists will be presenting crisis intervention teams from a past, a present, and a future perspective. Our first panelist is Officer Paul Kwiatkowski. He will present on the history of CIT. So Paul is a retired City of Moscow police captain and will be presenting on CIT past. He is in no way past his prime. He was in his position at the start of crisis intervention teams in our area and was instrumental in getting our local recovery center up and running. Next slide, please. Our second panelist is Laura Thaler. She is employed by the Department of Health and Welfare, where she currently leads our 5-county region in crisis intervention team training. Laura will present on what current CIT training looks like, who it involves, and the goals of the specific training. When not working, Laura is very much present for her 2 young children and will be sharing with us her perspective on CIT in the present. Next slide, please. Our third panelist is Teresa Shackelford. Teresa has spent most of her career working in crisis mental health. She is currently program manager for behavioral health in our 5-county region. Enjoying the long-awaited empty nesting years at home, Teresa will be sharing her vision of the future of crisis intervention. Next slide, please. And last but not least, we have 2 representatives from our local law enforcement agencies. Chief Fry is chief of the Moscow Police Department, and Richie Skiles is the sheriff of Latah County Sheriff's Department. Both began their respective roles in 2016, one by selection. Next slide, please. And one by election. After a lifetime of experience and training within the respective departments, community policing is a priority listed in both departments' mission statements. They will be sharing with us crisis intervention and training from a law enforcement perspective. Next slide, please. Oh, go ahead and turn off the PowerPoint for now. Each panelist will have about 8 to 10 minutes to present on their topic, and I will let you know when you have hit the 8-minute mark. No one will complain if you finish your topic early, but please be respectful of the other panelists in our audience by wrapping up when I give you a time warning. We will conclude with about 30 minutes of questions from the audience. Please use the chat box to submit your questions at any time during the panelist presentations, and I will be reminding you to do so. If your question is directed to a specific panelist, please clarify that in your question. Like questions will be condensed together, so don't be dismayed if your question is not answered or asked word for word. Comments and stories will be stored in the chat for panelists to review later, but will not be shared. Please keep all questions respectful, clear, and concise as possible. Let's go ahead and start by looking at crisis intervention teams past. Go ahead and take it away, Paul.
Hi, I'm Paul Kwiatkowski. I was with the Moscow Police Department from 1994 to 2017. Um, in the early 2000s, we noticed that I don't think it was something we discovered. It's always been there, but we noticed more responses to issues related to mental health crises. And at the time, the state police academy had absolutely no training for officers to understand what they were responding to. I checked this today, and in 2013, I attended the first CIT training in Lewiston, Idaho, or not the first, the second CIT training in Lewiston, Idaho. I was skeptical, thinking what was going on. I heard good reviews about the training, and spent a week with this training team, and they put on an excellent show. Our officers on the street at the time would respond to calls for an emergency. Young officers will respond to a call because it's usually a crime that's being committed or there's some sort of violence taking place. The first thing the officer does is when he arrives, he obviously wants to make the scene safe, take care of the bad guy, and make everybody feel comfortable, and then move on to the next call. What we didn't have in our tool belt at the time was the understanding that some of these calls involved people that were experiencing an episode with a mental health issue. We didn't have the ability to, we didn't have the training to take a look at someone or talk to somebody and say, this isn't what it appears to be. We need more help in this area. There were some situations around the country that resulted in people losing their lives, when in fact, if they would have had training and understood the situation, they may have responded differently. CIT training gave the officers that opportunity. It experienced. We actually sat down and we talked with people who were diagnosed with certain mental health issues, and trying to understand what they were going through. The team put together training that let the officer experience what an individual might be experiencing on the street when they arrive. So when I went through it, I was a senior officer at the time, and I thought, okay, if I'm going to lead from the front, this is what we'll do. I'll go through this training, see if it's worth the effort and worth the time to send other officers to this training. I came out of that 40 hours of training, and I was extremely impressed with what happened, with what was presented, with the training that I received. And I had worked the street for quite a long time prior to that. I decided at that time, I was in the fortunate position to run the operations division for the Moscow Police Department, which meant that I had all the patrol officers working for me. And it was my goal, working under Chief Duke at the time, to get each individual officer through that training. I felt it was necessary for the officers to have this, at least understand what they might be entering into, how to deal with it, how to deal with the individuals. If someone's experiencing a crisis at that moment, slapping handcuffs on them and throwing them in the back of a police car is not the answer. Although that's part of the procedure, but it might be able to move it forward in another direction. Some of the officers were reluctant, but we got them through it. Everybody, as many as we could send to that training, we sent to that training. To this day, I believe it's still going on. I've been retired 3 years, so all I can speak to is the past. I really thought that it was a good program. I believe it is still being presented to officers around the street. There's not a whole lot to, the history of it. That's pretty much the history of it. Is there any questions or?
I'll ask folks to go ahead and put their questions in the chat box.
Okay.
And we'll be answering questions at the very end. Is that all you have for now, Paul?
Yeah, that's all I have. I mean, that's pretty much the history of CIT.
Okay, we'll go ahead and move on then to Laura, who will present on CIT currently.
Hi there, my name is Laura Thayer, and I work for the Department of Health and Welfare. I have worked for the Department of Health and Welfare since 2007, and I have worked with CIT for the last 5 years. We sent our first bunch of staff to CIT Train the Trainer in 2012, and through attrition, we lost those employees, and so it's sort of been handed down to different staff people over the years. And CIT has been something that I have really enjoyed being involved with, and have hosted the trainings for the last 5 years. CIT is really a combination of 3 groups of people working together. It's about first responders, it's about mental health providers, and about our community members. And it's really about all 3 of us coming together in one joint effort to provide the best care for those who are in a mental health crisis. Sometimes we look at why did we get here, but it's a combination of a lot of things. The lack of mental health crisis services just across the United States has resulted in law enforcement becoming the first responders for most mental health crises. And that's not uncommon here in Idaho. That is oftentimes the first line for those who are experiencing a mental health crisis. But a crisis intervention team is a program that is innovative, community-based, and it is an approach to help the outcomes of these kinds of encounters to provide a positive resolution. CIT is in over 2,700 communities nationwide, and it works on building these connections between law enforcement, mental health providers, hospitals, emergency services, individuals who have a mental illness, and their families. Through collaborative community partnerships and intensive training, CIT improves communication, identifies mental health resources for those who are in crisis, and it also works to ensure officer safety and community safety. So where did CIT come from? CIT started, and it came from an incident that occurred in Memphis, Tennessee in 1987. Police responded to a 911 where an individual was threatening suicide and had a knife and was harming himself. And at that time, officers were trained to respond with deadly force if they felt that somebody's life was in danger. And so unfortunately, because this man became upset, he was killed by the officer. So Memphis wanted to work changing the way in which they responded to mental health crisis. And at that time, they joined with the NAMI organization, and they developed what is now called the Memphis model. And that is what we still use today when we train for CIT. And that is what we use when we look at sort of the foundations for our training. There's a couple of basic goals for CIT: improve officer and consumer safety, and to help persons with a mental illness or mental disorder or addiction access the treatment that is appropriate, and to help divert them away from the criminal justice system if their behaviors are related to their illness. CIT helps keep people with a mental illness out of jail, and it also helps them access treatment. There's been many studies that show the effectiveness of engaging in a CIT program and the engagement that clients may have with outpatient services, and also in having a reduction in crisis-related 911 calls. CIT also reduces officer injuries, SWAT team emergencies, and the amount of time officers spend on a disruption of mental disturbance calls. Here in Idaho, like I said, we sent several staff within every region to the CIT Train the Trainer starting in 2012. And we provided our first CIT training in 2013. Every year we offer a 40-hour CIT Academy. Last year was the first exception that we had, and we offered a 32-hour post-academy. And every year we train roughly 20 officers, and we have a variety of different agencies that send officers. This is just a list of some of those agencies that send people. We try to cover a lot of information in that 40 hours. We cover what is a mental illness. We go over a lot of the diagnostic criteria for clinical disorders and personality disorders. We talk about substance use disorders, how to treat mental illness, different medications that may be used. We also like to bring in community providers, as many community providers as we can, so that they can introduce themselves to officers and discuss the services that they have. So we also bring in adult mental health, children's mental health. We bring in the developmental disabilities program. We bring in St. Joe's, which is our local psychiatric hospital. We bring in the VA, and they talk about the programs at the VA and PTSD. We also cover excited delirium, and we also cover de-escalation techniques. So de-escalation techniques are a lot of the baseline for what we do with scenario training, where we have many of our staff members help train officers in a scenario where they can use their skills. That is all I have, so thank you. If you have questions after this, please don't hesitate to email me or give me a call at the Department of Health and Welfare. Thank you.
Thank you, Laura. We will now move on to CIT Future with Teresa Shackelford.
Hello, and thank you. I am going to share my screen here. I just need to make sure I get back to the first slide. Sorry about that. Hold on just a second. All right. Okay, there we go. So what I am going to talk about is, do you see my screen there? Okay. So I'm going to talk about what we have recently started called CITC, Crisis Intervention Team Collaboratives. This is something that we have, that we actually started a while ago in Region 4 where Boise is. And we have, as a division, decided that we want to spread this around the state. Law enforcement is also very interested in it. And so we have recently brought this to Region 2. And this is how we hope to, I think in this state, we have done a really good job with crisis intervention team trainings But we frankly haven't done a great job in a lot of our communities in taking that training and then turning it into more of a team collaborative approach as opposed to just a set of skills. And so because of that, we added collaboratives to the end. It seems a little redundant, but we did that because CIT has sort of come to mean the training to most of us in Idaho. So CITC is our collaboratives. And so what we did, I used to live in the Boise area when we started CITC. And when it first started, we didn't even really have a name for it. It was just the mobile crisis unit and the local law enforcement getting together weekly to talk about some of the major emerging situations in our community of clients and individuals experiencing crises who really needed help, and they needed more of a collaborative approach. And it sort of grew from there. And so now what we have is what I would call like an interdisciplinary team meeting that involves kind of the main players in the crisis response system. So ourselves from our crisis staff from the regional behavioral health offices, we have our law enforcement involved, we have the crisis centers involved, local emergency departments, adult protective services, and then in each area, if there are other entities that it makes sense to involve them, then we do that there as well. So here in Region 2, we have started up a CITC in Latah County, we have one in Nez Perce County, we have one in Clearwater County, and we have one jointly for Idaho and Lewis counties. So each of those communities is very different, and each one might have slightly different membership in CITC. So the purpose of, I'm not going to read all of this, but the purpose of CITC is basically to take the principles of CIT and apply them as a collaborative team to improve the follow-up and continuity of care for folks who are experiencing crisis and touching the crisis system, to link them to more ongoing services, to help support them and hopefully help keep them out of future crises. One of the best things that we do with CITC, I think, is focus on those folks who are kind of cycling through. So we know that whatever we've done before hasn't been working very well, and so we're trying to take a different look at what's going on and bringing in different resources to try to help that individual. So the main purpose is really just to help people reduce their contact with the crisis system, help to direct crises to more appropriate avenues so that our law enforcement can focus more on enforcing laws, and the behavioral health system or whatever other parts of the system need to intervene are called in to intervene. In CITC, we agree to work cooperatively to, we want to promote and increase access to CIT training programs. We want to reduce the number of people who are in the jails or having law enforcement contact due to behavioral health symptoms or crises. We want to help people learn who else they can call besides law enforcement if they're experiencing a behavioral health crisis. And basically, ultimately, we want to increase safety for everybody by increasing understanding and access to resources. So what does that actually mean? Those are pretty lofty goals. But so what it means is we sit down, this group of representatives from all of these pieces of the crisis system, and we discuss specific crisis situations that are emerging at that time in our communities. And we brainstorm together to try to figure out what's a better way to respond, what's a more thorough way to respond than what we've been doing. And then we come up with a game plan. So kind of a very generic example is, let's say law enforcement's receiving many calls for service regarding one specific person who's having a crisis that's behavioral health related. The solution for this person isn't clear cut, or it isn't law enforcement related, or whatever we've been doing hasn't really been working for one reason or another. So the CITC explores other possible solutions, and then we sort of assign tasks of who's going to do what, who's going to reach out to this individual to see which of these resources that we've come up with they'd like to take advantage of, help coordinate with them, link them to different resources, that sort of thing. So it's really just, we sit down and try to get creative about it. One of the big questions that I get a lot about CITC is, what about privacy? Which I think is a very important question. So the default in CITC meetings is we don't use names or identifying details unless it's needed. And what needed is it's either sort of an emergent crisis or a situation where we do need to engage in coordination of care activities. And these are covered under HIPAA, for those of you who are familiar with HIPAA and the privacy laws. So once we determine that there's some coordination that can happen, then those key individuals who are going to be involved in helping this person and reaching out to them will connect and share identifying information. It's always on an as-needed basis, need to know. We don't share more information than needs to be shared to get to where we need to be, which is helping to figure out what can be more helpful for this person. So the reason I see this as kind of the future is, you know, we recently have had this Medicaid expansion in Idaho, and what that's done for the regional behavioral health offices is it's really changed our work. Prior to Medicaid expansion, we did a lot of direct services for folks who didn't have insurance. So now most of those folks do have insurance and are able to access care in the community. And so we have shifted our focus, or in the process of shifting our focus, more toward trying to expand our crisis response. So across the state, as we're able, we are rolling out a mobile response. So this goes really hand in hand. This is why it's a perfect time for us to have CITC in this community, is as we roll out a mobile response, which means that when someone's having a crisis, we can show up where they are. If law enforcement respond to a crisis, they can contact us and we can meet them on the scene. And if it really isn't a law enforcement issue and that law enforcement's comfortable with it, they can leave and leave the rest of the situation to us. So we're slowly expanding this as we're able to. Right now, we have started this in Lewiston. That's where our main office is in this region, and it's during business hours for the time being. We still are doing a lot of direct service that we haven't been able to transition out yet, so it's sort of dependent on our staffing. And then our next step will be to expand into Moscow. We're doing some hiring, and so once we get the hiring and training done, we will launch it in Moscow. We are in this process, well, in everything else, but especially in this process of responding mobily and CITC, we're working very closely with our crisis centers. In Region 2, we have the Rural Crisis Center Network, which is a more unique model than they have in any other part of the state. Every region now has a crisis center, but our region has 3 kind of mini crisis centers, which is really helpful for our very spread out rural frontier region. So people are more likely to have a crisis center close to them. So we work cooperatively with the crisis centers on helping people to figure out what are their resources. And the crisis centers are also part of our CIT collaboratives. I have some slides here just on various resources. I know some people are calling in, so they can't see this, but we have the Crisis Center Network number up, which is 877-897-9027. And then Region 2, we also have a 24/7 on-call crisis line, which is 208-799-4440. And I have some other slides here with resources. And I think I'm probably going over time, but if anybody wants a copy of this, let me know and I'll send it to you. And likewise, if you have questions for me after this panel is over, you can call me at 208-799-4440 or email me. My email's on the screen. It's Teresa, TERESA.Shackelford, SHACKELFORD @dhw.idaho.gov. And now I will pass it on to Chief Fry.
Thank you, Teresa. You did go a little bit over, but the past and the present were a little under, so I decided to go ahead and give you that time. We will now move on to Chief Fry.
Thank you. I'm James Fry. I'm the Chief of Police for the City of Moscow. And the Moscow Police Department has worked very hard collaborating with the Department of Health and Welfare and the Sheriff's Department to provide the services that are needed with individuals with mental health issues. We respond to calls weekly, daily, sometimes multiple calls with the same individuals. So it's very exciting for us to be a part of the program with the upcoming mobile crisis team that's going to give us the capability to clear some of those calls, but yet still get the individual help. I think the CIT training that our officers have gone through, and it's been continuing since Captain Kwiatkowski was first went to the training, has transformed law enforcement in the way that we go to those calls, the way that we handle situations with individuals with mental health crisis. I did see one of the questions pop up. Do we have continued training? We do. We have to have 40 hours of training every 2 years. So it's mandated that by state law that we have that training. Some of that is with CIT training. They're actually getting CIT training at the academy now, which is just started in the last few years. I think it's 4 hours every officer receives, which isn't a lot, but it gives them at least a little bit of some tools in their tool belt to begin to deal with the calls that they will go on. And then we continue on with the CIT training as they get back with our department from the academy, and we try to get all officers to go through that training and continue that. The Moscow Police Department, like I said, we continuously deal with calls of service for mental health crisis. And when people are in crisis, we have to handle them differently than we do other types of calls. We have to understand what they're going through and some of the characteristics of that. So the training has helped us. The programs that we are putting in place, I think, will help us in the future, and it will expand and even get bigger and better as we continue to move on. So thank you.
Thank you, Chief Fry. We will now move on for the county perspective from Richie Stiles. Take it away, Richie.
Well, actually, thank you very much. Richie Stiles, Latah County Sheriff, and I'm glad to be here. I think that these are very helpful when we get together and we talk about these things, and we can bounce ideas off of each other to help push forward and make things better. A lot of what Chief Fry said is the same exact stuff we do too. We work together, Chief Fry and I do, and we try to send our deputies and patrolmen to a lot of the same exact training. They each go, his patrolmen and my deputies go to the police academy. We go to the same academy and we learn a little bit about this stuff at these academies. And then we have continued training, as Chief Fry said. Each year, each deputy has to have continued training, and each patrolman, which basically the standards for Idaho are the same for the patrolmen and the deputies. So we just continue to go. I've noticed in the last 4 years that I've been the sheriff that we have a lot more calls for these individuals that need help. And I think that a lot of people, the Recovery Center, the county commissioners, Moscow PD, Gripman, the state of Idaho, we all realize that this is serious, and it's getting worse, actually. I'm dealing with two individuals that live in Latah County, and it's almost daily that we get a call or an email, and they're not committing a crime. So there's not much that I can do, but we still respond and we still talk to them. One of them has hallucinations, and the bad guys are trying to get him, and we know we respond to his house and we try to help him. I don't know how many times we've been there. Another one lives in the valley, and we respond to her a lot. It's just, she runs away. She just needs help. And so we need more programs. And obviously they need to be funded somehow, but we need more programs for these people that are having these kind of issues. They're really not committing crimes, but they need help. And so also it seems like what little bit of help they do get sometimes isn't really helping very much, and not because the help isn't good or the people don't care. It's just that the place that these individuals are in, it doesn't seem to be helping very much. I'd be more about training. I send the deputies to a lot more of this training. In the last 4 years, we've become more aware that this type of training, this crisis type of training, is getting to be something we need more and more. It's not something we can ignore anymore, or just, push it off onto the next. I'd like to talk about an incident that we had. I think it's been about 1.5 years or so ago. Chief Fry could contest to this. One of my deputies, probably been about 2 years ago, one of my deputies was on Highway 95, and this person with mental illness stepped in front of the patrol vehicle, and the deputy saw them in time and stopped, and I actually arrived on the call too. We took this individual who had no place to go or nothing to do. We asked him if he would self-commit, and he said yes, and we took him to Gripman, and he was there for about 4 minutes. And as soon as he left, my deputy left, because it was a self-commit, and you can leave on a self-commit whenever you want. He commenced to walk down Main Street, throwing rocks through, throwing bricks and things through windows, through the fire department windows and things like that. And then now he has committed a crime. The sad thing is I've got to arrest him now for this crime when he really shouldn't need to be arrested to begin with. So the help, somehow we need to get help for an individual like this before I have to arrest him. We go to a lot of calls that we don't really want to make the arrest, or there maybe isn't enough crime to make the arrest, but they need help. And so we still need to push forward to try to get help for these people. Thank you all. Chief Price said a lot of the things that we're doing, so I'd just open for questions when people have questions or whatever. Thank you very much. Thank you, Kathy.
Thank you very much, Richie. And it sounds like some of what Teresa is talking about as far as, crisis intervention team collaborative coming up in the future will directly address this need. I certainly hope so. I'm going to go ahead and move on to some of the questions from the audience. I'm going to excuse myself. I'm using 2 different screens in order to make sure that I don't miss any questions. And what I want to do is, first of all, I think this is a question for Laura. She wanted to know, what is excited delirium? And then I think the second part of this question is for law enforcement. So if you could just explain, Teresa, what delirium is, I think that would help our audience out.
Yeah, excited delirium is somewhat of a controversial diagnosis, but it is a state of extreme agitation. It's often noted with people who maybe have been under the influence of some substances, and it presents as an excited, disoriented state where people may be sweating profusely. They may seem to have a great deal of strength. They may not feel pain. They may be a little bit aggressive. And they also may be experiencing hallucinations.
Okay, thank you. This next set of questions I'm going to go ahead and address to the law enforcement officers. And Paul, I think you're still in that category. The questions were actually addressed to you, but I think they'd be good for all three of you. What folks wanted to know is, and maybe Paul can answer this first part, is could you speak to why some officers were reluctant to attend trainings? How often are the CIT trainings held? And does CIT, if you get that 40-hour course, are you required to renew that training similar to like teachers' CEUs? So why don't we start with Paul on the initial reluctance, and then we'll move on to the other two of you.
When it first started, it was a new concept. And just like anybody in any professional field, there are some people reluctant to look at this as a new wave of training that we can move forward to and help each other. Cops are no different than anybody else. You have to spend time at training, and spending time at training takes you away from your job. You get behind, and the reluctance was, I'm a police officer, I'm going to go on the street, I'm going to take bad guys to jail. And James and I were working together at the time under Chief Duke, and we believed that the more education, the more training that our officers had, the better they could deal with these situations. There's no cookie cutter process to show up at one of these calls and say, okay, A, B, C, D, let's go. It happens instantly, it changes instantly, and these officers would see this as this individual trying to break the law and revert to that situation, revert to taking someone to jail or writing them the ticket. The CIT training, once we got the officers to the training, everybody that came back while I was there really enjoyed it, and they understood the difference. They had more tools to use. They were able to evaluate a situation a little bit more clearly. They were given questions at CIT training that they could ask an individual without being, here I am, a police officer, and I've got all this, I got a uniform on, a gun belt on, but the way they were trained was how to become more human and interact with this individual in crisis. That was the reluctance. It's something new. We're not going to change. We're going to continue doing this. Our plan was we're going to change and we're going to do it differently. And everybody came back well with it. What was the second part of the question, Kathy?
I think that was the part that I had for you, is that initial sense. And then if Chief Fry could maybe talk about how many folks in your department have been trained, and if they're going, with that 40-hour a week training, do they have to renew that at any specific time?
Like I said, as officers get back from the academy, we try to get them into the CIT training. I think part of the issue is that I believe it's only once a year. So, with the 20 officers that they're training, we may get to send one or two to that training. So, it's not as much as we would like, but we're trying to continually send officers to that. Does it have to be renewed? No. Do we like to send officers back to refreshers? Even if it's online, we try to do that. We try to keep officers engaged in that. But I think one of the things with being an officer and dealing with mental health issues is you're being trained every day to use those skills. You're going on calls daily, sometimes multiple times. So I think that helps keep our officers a little bit fresh and up to speed with that.
Thanks. Would you like to contribute anything, Richie? And then I will call on you, Teresa.
Yes, I would like to add just one quick sentence of that. What Paul was talking about was when we get into this profession, we like Paul says, we want to go find bad guys. We want to track people down. We want to do things. We want to keep people safe. But on the mental illness part and things like that, we don't quite understand that because we don't have enough training on it. We're not doctors in that field or whatever. And so I think the lack of interest would just be because we don't understand it so much, which is what we've been doing. And like Chief Fry said, we can only send one or two deputies or patrolmen a year to something like this. I think that Chief Fry and I could actually get together. A few months ago, we got together and we talked. I got together with the county pretty much, and we talked about bringing verbal judo to help us talk to people in any of these crisis situations or any other kind of call we go to. And I think that if Chief Fry and I could get together and maybe we could get a qualified person to teach on this, we could bring that person to Moscow, and we could actually send, maybe 10 people from each one of our departments, which would be a lot better, and it would speed this process up a lot more. So that'd be my comment, I guess. Thank you, Kathy.
Thanks, Richie. I see a funding request coming across our desk soon. Teresa, you had a question. Why don't you go ahead?
Oh, I was just going to say, I think since I'm representing the ghost of crisis future or whatever, that we are currently in the early stages of, but we're working on hopefully bringing CIT to our region more often, and also in different ways. So especially some of the smaller rural agencies will have an easier time to send folks. So we might break it up. Instead of a solid week, it might be, once a week, every other week for, you know what I mean? We're looking at different ways to basically bring CIT to as many officers and other first responders as we possibly can.
Thank you, Teresa. Boy, the questions are starting to come in pretty quickly. Quick question for Teresa, and this could be, maybe it'll take a little bit of time, are all the services that you're referring to offered to everyone, even uninsured individuals without addresses, in other words, transient folks? Are these services available to anybody who walks through the door?
So in terms of like our crisis services, absolutely. Our crisis services are available to everyone, insured, not insured. There's no billing or anything like that. Our goal really is to make it as easy as possible for people to access help when they're in crisis. And so yeah, anybody can call those numbers. Anybody can go into the crisis center. Anybody can call our crisis line. And as we really get our mobile response up and running, we will respond to anyone in crisis. So, yep, available to everybody.
Okay, well, I've been getting a flurry of questions that are fairly similar, but hopefully I'll be able to condense them a little bit. And I think they're part of this crisis center future that you're talking about, Teresa. Are social workers or other mental health professionals ever included on any of your calls? In other words, do you ever swing by the Department of Health and Welfare, either Richie or James, and pick up a social worker or pick up a mental health practitioner to take with you on a call? James?
I think it depends on the call. There are times that we have health and welfare out with us, checking on individuals. And, as we get down to the hospital, obviously health and welfare starts to play a vital role, as well as the prosecutor's office. I think it needs to be mentioned that the vital role that they play in helping get individuals the help that they need. So we do collaborate, but I think what you're seeing in the future is we're starting to realize we have to use the team approach. We have to come together as professions that bring the best service to individuals in crisis that we can. And I think that's what you're going to start to see in the future, and it's going to pay great dividends to our communities.
Richie, if you could also answer that question, and then also add, does probation ever participate?
Yes, so Kathy and others, health and welfare actually calls us regularly if they have a situation. We've let them know also, but they know that they can call us at any time that they feel like they have a situation where they are going to contact somebody or deal with somebody that may or may not have a past of violence or anything like that. We've gone out in the county. The deputies will do like what we might call a civil standby, would be something that the deputies would kind of just be there just in case health and welfare might have an issue or whatever. So they do, well, I think we do work well together. They're welcome to call us at any time, and we will always respond and go with them. And parole and probation, same exact thing. They do a really good job, and they don't call us very often, but there's times now and then that they do give us a call and if they need assistance. But yes, I think those kind of things, we're all working together pretty well, and I encourage that. Thank you, Kathy.
Kathy, can I just add one thing?
You bet.
We were talking earlier about the officers making the arrest and taking individuals in crisis to the jail. There's other programs too that provide help to individuals. One of them was the Latah County Mental Health Court. And this is a court for individuals who have been arrested, have been diagnosed, and given the opportunity to go through this court system. James and Richie both know about it. They can talk probably in greater detail than I can. It's been a few years since I've been involved, but that's also available.
That's really good to hear. And I know that with the crisis centers, as long as the person is not, they have to be evaluated first to make sure that they're not, a present danger to themselves or others, and also to make sure that they're not in medical crisis. But then, if they just need a place to de-escalate and calm down, relax a little bit, maybe get hooked up with the services they need, then that individual can be taken to the crisis center. Can you, Richie, talk a little bit about what happens when a client is brought into the crisis center?
Well, one thing first I'd like to say is the mental health court actually does. I know had the judge talk to a couple of us one time, and there's been some really good results of people that have actually recovered, you might say, from the mental health court and actually have become good, productive members, and some fall back, obviously. And to the other, maybe Chief Fryer or somebody might be better to speak at that on the question that you asked me, Kathy.
So Kathy, yeah, thank you. As officers respond to calls and we find people that are in crisis, we can take them down to the crisis center, and we do a quick intake where there's some questions that are asked, and the person can stay for up to 23 hours and 59 minutes, and then they can leave, basically walk outside and come right back in to continue if they're still in crisis and they still need help. This is given officers the ability to clear calls a lot faster, but get the person the help that they need. And then there's a counselor that will come in and meet with that individual and start to help them through their crisis time, which has been a great benefit to the Moscow Police Department and Latah County Sheriff's.
This isn't a question on the panel around the Q&A section, but I'm going to go ahead and ask Teresa maybe to share a little bit about the Region 2's decentralized crisis center model. What are the advantages of having 3 mini crisis centers as opposed to a big crisis center like they have at Kootenai County?
Well, the main benefit is that if the way most of the other crisis centers or all the other crisis centers are is that they're located in the population center of that particular region. And so for us, that would be Lewiston. And so that would mean that we would have one crisis center in Lewiston, and whether you were in Troy or Grangeville, if you need to go to the crisis center, you'd have to go to Lewiston. So the benefit of this is simply just accessibility. We have a big, geographically large area in Region 2. And so we have one in Moscow, we have one in Lewiston, we have one in Orofino. And I know that they're working hard to try to get one in the Grangeville or area or somewhere out there as well. So yeah, that's the primary benefit to the folks accessing it. Another benefit is that it, as Joyce put in the chat to the panelists, that the crisis services are delivered close to where people's supports are located, so they don't have to leave their community to get these services. The other thing is that it's just a more cost-effective way to do it. If you have, so the way the crisis center, all the other crisis centers are run, they're up and running and staffed 24/7 in one facility, where the model that Region 2 is the model being used in Region 2 is if someone needs the crisis center after the regular business hours of the facility, then there's an on-call mental health clinician who is activated. So you don't have this entire team of people being paid 24/7, even if no one's accessing the services. So it's fiscally responsible, and it's just more accessible to folks.
Thank you, Teresa. I have another couple of questions for Chief Fry and Sheriff Skiles, and what they would like to know is, how do you decide on a call whether to take a person to the crisis center, the hospital, or the jail? Why don't you go ahead and go first, James?
Officers will decide that based on if there's been a crime committed, number one. Number two, we have to also look at, is the individual a threat to themselves or others? So if they're a threat to themselves or others, they're going to go to Grittman Hospital. And if they're just in crisis, then they would go to the crisis center. We look at those three things. Has a crime been committed physically, where we can, with evidence, prove that? Are they a threat to themselves or others? Then they go to Grittman. And then we put them on typically an involuntary hold, which means we have to be there with them. So it's the differentiation.
Richie, do you have anything to
Hey,
add?
Kathy? Oh, sorry.
So I'm going to let Richie finish first.
So just on what Chief Fry had said, so like if we decide that they go to Grittman, then I have to have a deputy or a jailer deputy stay with them for the time that they're being evaluated or whatever. Chief Fry and I both have had actually personnel, a deputy or a patrolman up to a week, 10 days on one person on a medical hold. And it really strains our personnel, because it takes a person off of a shift or whatever. But anyway, if they don't get evaluated right away, or they seem to be really like they're really going to hurt themselves, we have to stay on that. I did get a contract with a security company that helps us with that a little bit, but they don't seem to be available a lot either. So, but it does help a little bit. But anyway, thank you, Kathy.
You bet. Teresa, you had something you wanted to say.
Yeah, this is kind of going back to one or two questions ago, maybe, but I just wanted to insert in here that part of our goal with CITC and kind of rolling out this mobile response is that our mental health clinicians will be available to law enforcement to respond with them to crises. So we don't have enough staff to ride along with all of the calls, but we'll be available so law enforcement can call us and say, we're responding to this, or we've shown up here and we think you could help. And then one of our behavioral health professionals can show up on the scene.
That's a wonderful, wonderful future vision. We need to train a lot more mental health professionals in our region to cover all of these needs. I have a bunch of questions about training, and these are addressed to, again, Chief Fry and Richie Skiles. And what they want to know is, within the two departments, there's the CIT training that your officers receive in post, and that's about 4 hours worth of CIT training there. But I think what this person may be asking is how many have had the full 40 hours of training, and you can just give me percentage of officers in each department. And I know it's not real high because you can only send people once, but I think people want to know the truth.
I would say probably with our agency, maybe 30%.
Laura, did you want to interject?
I just wanted to say, though, Latah County is one of the counties that we've had the most support and most participation for CIT. So this is probably by far the highest percentage that we have in this region.
Thank you, Laura. Thank you for that. And Richie, in your department, about what percentage have had the 40-hour training?
I wouldn't know that. I don't have that figure.
I actually do know, if you can tell me your total number of deputies.
I think I have about 20 that are on the road.
Then you, so how many total though? Including, you know, for
Probably
detention, probation, or dispatch.
with the jail too, so probably about 32 or so.
Then about 30%.
So about the same.
Yeah, so about 30%, because I think Tim gave me the number of 10 folks have been through training in your department.
Nice. Thank you, Kathy.
The other question, oh, Paul, go ahead.
Just so people understand that both of these agencies are kind of stepping stone agencies where officers come in, they spend 2 to 5 years at these agencies, and then they roll out to another location. And the chief and the sheriff send their officers off to training, and the officer gets the training, spends his time there or spends her time there, and then they move on. So it's a constant flow of people coming in and going out, and you try to maintain that training level. 30% is really high for this. And a lot of these officers pick up their training on the street too, working with an officer who went to CIT training. It doesn't sound like, you know, people will hear it and say, the sheriff and the chief are not sending their officers off to the training. This is important and required. Yes, it is. But the other factor is the transfer of officers out of the agencies. You know, when I was there, I would send guys to training everything they wanted, and I had some of the best trained officers probably in the state. And the call came, and the guys are taking trips to the west side and making more money, getting better training, better funding. And so these guys are doing one heck of a job trying to maintain what they can here. That's all I wanted to say.
Thank you, Paul, for pointing that out.
And I have one more question, and I believe this one is for Laura. It's one thing to have law enforcement officers trained, that's important, but can the general public take a CIT training course? Or let's say somebody who's working at the Latah Recovery Center or a mental health practitioner. I know that it was very valuable for the county employees when Richie brought verbal judo to the county employees. I participated myself, and it gave me some really good tools, because when people come into the courthouse, unless they're getting married or voting, they're generally not happy to be there. So we have people that aren't necessarily happy when they walk through our doors. So just being able to deal with people even that are unhappy was a good skill to put in my pocketbook. So if you could talk about how can the public access CIT training?
Yeah, we have had a variety of different providers, mental health agencies, different organizations attend our CIT training. We do try to reserve lots of the seats for first responders, and if we have extra seats, then we definitely would open it up. If we change the way in which we deliver our CIT training, which is what we're looking at doing, we would definitely be interested in helping our community receive the education. A lot of it is very focused on some things that may not be as applicable, but we do cover a lot of information that is always beneficial for people to learn about. And so, yeah, I mean, we would be willing to entertain ideas to educate and provide trainings as much as we can. And definitely probation, yes.
Yes, I was just I mean, if we want to talk about some first responders, you know, especially with the courts being in quasi shutdown right now, I think our probation officers and the folks in that office are really taking a pretty heavy hit of interaction with the public above and beyond what the rest of us in the courthouse are having to do right now. folks that are out.
Right, and yeah, the goal of CIT is to bring everybody together, our community together, the mental health providers together, our law enforcement together. And so we want to be the instrument to help bring these together. And so we are always open to ways to educate and support each other.
That's awesome. Thank you so much, Laura. I'm not seeing any more large questions trickling in, so I'm going to give everybody a chance to get your last questions asked. My folks that are working in the background, if I missed a key question or a key topic, please let me know. I know that there are a lot of resources in the chat right now for folks so that they can, phone numbers and emails and all sorts of other contact information. Teresa had something more to say.
Yeah, regarding other folks taking CIT training, as Laura was saying, a lot of it is really targeted to first responders, especially law enforcement specific type of work. So we do try to keep most of the seats open for law enforcement. It's very targeted to law enforcement, but we are happy to provide more tailored trainings to other agencies. So we can do like a de-escalation training for, like I saw somebody asking about the recovery center, for instance. We would be happy to tailor a training to anyone. We love doing trainings.
Okay, I have a couple of more questions. One is, somebody would like to have you repeat important numbers or emails for the audience. I am a little unsure with this format whether or not the audience can actually see the chat thread where a lot of this stuff has been written down. Maybe Corinne can answer that question to me via text. And in the meantime, I will wait for any more questions that are coming in. So we do have one question that says, and maybe Laura, you can answer this. She wants to know what specific trainings or techniques are taught in the trainings. And she would like to also hear more about de-escalation, how it is trained for and how it works. And maybe law enforcement can contribute to that as well. So go ahead,
Sure.
Laura.
Yeah, we have an officer here with the Lewiston Police Department that does our de-escalation for our CIT training. He has done it since we started. And de-escalation is really about forming a relationship, some sort of interaction with the person that you're encountering and it's also about being aware of your movements and the way in which you're interacting, and to have clear communication, and also taking the time to listen to the experience of the other person in the crisis and finding common ground and coming up with a resolution together. And I'm sure some of the officers have been through de-escalation training. They can probably talk about it as well, or how they use it.
Hey, Richie, I'm going to let you go first this time because I keep picking on James first. So I'm going to pick on you and say, tell me what a typical, I'm sure there's nothing typical, but tell me what a typical de-escalation call looks like.
They can be almost any call we go to, actually. Domestics, alcoholic, not an alcoholic, but a person who's intoxicated. It's really key to get a call that you go to de-escalated, because actually if you can get it de-escalated, you can save a lot of headaches as far as even maybe not even making an arrest. I've been to calls where it's virtually impossible to de-escalate, no matter how hard you try. And that person usually, you go to a call, a guy wants to fight, and you can't talk him down. But I would say 9 out of 10 times you can de-escalate the situation, and I think that's, I don't know, Chief Fry might be able to say it's a less number for Moscow. They have a bigger call volume than we do. So he goes to a lot more calls where he needs to de-escalate maybe. We go to those same kind of calls. They're out in the county, but it's really key to be able to get there. And I know I've talked myself out of a fight more than once, just going to a bar fight. You know, you go to a bar fight and people go, oh, there's the cop, and they want to fight or whatever. And you got to talk fast, or you could have, go home with a black eye. But anyway, de-escalation is, I've always told the guys or anybody that asks me that my number one tool is not what's on my belt or in my car or anything. It's my mouth that can get me in or out of trouble really fast.
Okay.
Thank you, Kathy.
James, would you like to respond to that question?
Yeah, you know, as officers go to calls, and Sheriff Skiles is right, we have to be able to communicate with people, and we have to be able to communicate with people at their level, at the within the crisis that they're going through, and try to understand that. I think empathy goes a long ways. A little compassion goes a long ways, and how we stand, how we talk, the tone of our voice, all that makes a difference in de-escalation. But the key is that we communicate with the individual, and a lot of times we're communicating with the family as well to try to understand quickly what the individual's going through, what type of crisis they're in, so that we can try to develop a rapport with them and develop it quickly to slow things down for both that individual and for us.
Thank you, James. There was one question that came in earlier, and that just triggered that thought in my brain. Is it ever possible for a family member to call the police or the sheriff's office and say, you know, hey, I've got a son, this is where he lives, this is what he, you know, I know that there's some, you know, privacy issues there, but these are his mental health issues. Just so if you get a call from this particular number, you know, these are some of his triggers that you might want to avoid. These are some things that you could say that might be helpful. Is it appropriate for a family member to call the sheriff's department or the police department, or would they be better contacting health and welfare?
Yeah, I think that's totally appropriate. We want that information. The more information we have going into a call, the better we're going to be able to handle that, and we'll be able to deal with it much better. You know, we do welfare checks all the time for families where they call and say, you know, haven't heard from somebody, or you go check on them. So that information at that time is great for us.
Great. We have been getting a lot of requests for contact information for people that joined later. They only get the chat from the point they joined until the end. And so if all of our panelists could please contribute their names and phone numbers and or email addresses. I see that the Human Rights Commission is also listed on here, Ken Founts, and his number. So if somebody has a more general question, Ken or somebody from the Human Rights Task Force will also get back to them and make sure they get hooked up to the resources that they need. And I'm also supposed to mention that the Crisis Center can be accessed without a referral from any agencies, so you can walk in there. And Chief Fry, you had something else to say.
Yeah, I meant to say this earlier. You know, the police department, the sheriff's department, and the Department of Health and Welfare, our goal is to intercede before the crisis gets to the point where we have to take the person to the hospital. We can develop a rapport early on when we start to see that an individual is starting into a crisis and get them to the crisis center. It really does pay dividends to us, and that's part of what this mobile team is going to really push out there, because we'll be able to respond faster and stop the crisis, hopefully.
Thank you, James. I had the pleasure of riding along with Richie when I was campaigning for this office, and the thing that sort of blew me away is that, you know, when it came to talking to residents out in the county, there were obviously some of them that had been on the wrong side of the law at one point or another during their various and sundry careers, and yet there was such incredible respect and rapport between the sheriff and these individuals, and I think that's what we're all striving for in this community. Before we close, and I think we are going to close a few minutes early, good for us, I would like to give each of the panelists a chance to just say a few last words. It sounds like James has already said his. So I will call on Paul next to see if you have anything in parting that you would like to say.
No, I think our community does a real good job. My time with MPD, the number of cases we dealt with, we always tried to do the best for the community. You know, a police officer's day or a deputy's day starts off and they don't know what's going to happen throughout the day. People, we're not mental health social workers. We do the best we can. We have backup from Laura and Teresa. They're always available to us, and people just don't understand how fast things change and what this officer has to do in a split second. Chief Fry, Sheriff Skiles, both of them run great agencies. I've had the opportunity to work with both of them. I was proud to be part of all this. Thank you for inviting me.
Thanks for being here, Paul. Okay, one more question came in, as you knew they would at the very last minute. How often do you come across cultural differences in the midst of a police call or treatment? And I'm wondering if that's embedded into the CIT training at all. Maybe Laura and Teresa can answer that as they say their parting words. Go ahead, Teresa, why don't you go next?
Okay, I will let Laura speak to the CIT training since she's our expert. Of course, in our work, we often come across cultural differences, and as I see a lot of behavioral health professionals on this call, and I think, you know, one thing that we all have in common is we take a lot of trainings in cultural awareness and competency, and definitely do our best, but we can always do better. But in terms of any last words, I just wanted to thank everyone for coming. I want to thank Charlisa Davis for kind of organizing all of this for us, and U of I for their work, and Kathy for moderating. I think this kind of conversation is just so important for communities to have. We really appreciate working with Moscow Police Department and Latah County Sheriff's Office. They're wonderful when it comes to behavioral health issues with the folks they come across. They really want to do the best thing by people, and so they're great to work with. And so anyway, I love this opportunity to talk with the community. Please reach out to me if you have any questions about what we do or what you think we should do. I'm happy to listen.
Thank you, Teresa. Go ahead, Laura, and then we've saved Richie for last.
Thank you. Yeah, and I think it's the goal of CIT to include cultural awareness in all of their trainings. I know as counselors, those who are oftentimes presenting at CIT, those especially from our office, always try to be culturally aware and try to bring that up within that training. I also want to thank everybody up in Latah County. Latah County is one of the biggest supporters for CIT. It is a county that embraces the model of CIT and community togetherness, and I think that is crucial. As we move forward, we are changing what we do, and we are looking to be more present in the community for mental health crisis. And I know Latah County is ready for that, and I know they will embrace it to the fullest extent first. CIT also does take quite a lot of money to put on every year. Latah County is one of the biggest supporters that we have in our fundraising efforts. It is something that does prevent us from offering the training multiple times throughout the year. So if there are agencies or organizations who are willing to donate, we would be more than happy to discuss that with them. And I also want to know that we are also here for whatever is happening with mental health crisis, even if it's not a mental health crisis, just for community questions or concerns. So please don't hesitate to call. We have our number up there, the 799-4440. Get you to all of behavioral health, and then you can identify who it is that you would like to speak with. Thank you.
Thank you, Laura. And Richie, do you have any parting words?
I would just like to say thank you to everybody, and Kathy, thank you. And Teresa, I think that the mobile thing is going to be awesome when that gets up and running for Latah County. I think the resources, these conversations are awesome because we get to know what each other's resources and strong points are and where we can find help when we need it, because each call we go to is a little bit different, and then the person's a little bit different and they have different needs. And so the knowing what all our resources are is really super important. And it helps us move forward. My number is 208-669-1367, and that's my cell. If somebody needs to contact me anytime, feel free to. Thank you very much.
Okay, in closing, I want to thank all of our panelists for taking time out of your evening to be here. I want to thank all of our sponsors, especially the Human Rights Commission and NAMI. And then I also want to thank our audience for taking time out of their precious time off after work to come and listen to this discussion. And with that, we will close. Thank you very much for coming. Bye now.